Hi everyone, I'm Buwen Yao. Today I will introduce our study that compare median nerve displacement and sliding during gripping between dominant and non-dominant hands. Carpal tunnel syndrome is the most common nerve compression disease. It has a high prevalence and it is very costly. One of the primary causes is the compression of the median nerve as it travels under the ligament in the hand. The compression of the nerve is often contributed to repetitive motion of hands. One mechanism for nerve injury that people believe is that while the nerve moves relative to other structures in the carpal tunnel, the friction between the structures causes strain, tension, and compression. What we don't know is whether there's any difference between the dominant and non-dominant hand. Based upon the fact that we use dominant hand more frequently, exploration of the difference between sides could be important. Previous studies that have looked at movement haven't really settled on a great understanding of the nerve movement directions, where they only have fairly small samples. So we used a fairly big sample to describe nerve movement and compare nerve movement between dominant and non-dominant hand. Our sample was almost 200 people and primarily 25 years old female. All participants went through sonography examination in a standard position with a 12 MHz transducer. We recorded videos in both transverse and longitudinal plane. For today's presentation, I'll first talk about how we look at the dynamic movement in transverse plane. We asked the participants to open and close their hand while recorded the video clip. For example, this video here shows hand in resting position during gripping, in gripping position, and change back to resting. We extracted 2 frames from the video, one representing resting and one representing gripping. We then identified the nerve's center of mass by drawing 2 lines bisecting the area of the nerve, as shown in the left image. We draw another 2 lines to confirm this point. After the nerve center is identified, we then measured the horizontal and vertical distance from the nerve center to the edge of the frame, as shown in the red image. We did the same thing for nerve at the grip position. To calculate the endpoint displacement, we first calculated the vertical change and then the horizontal change. The endpoint displacement is then calculated using this formula. This table here shows the distance of the nerve movement. We measured both absolute movement and displacement. For absolute movement, we did not counter for the direction of the movement. Therefore, it is just the total amount of the movement, whereas the other is accounted for direction. For the example of vertical displacement, we defined moving up as positive and moving down as negative. So when summing up, the direction of the movement is counted as part of the result. We look at the absolute movement in displacement, comparing the dominant and non-dominant hand, both in vertical, horizontal, and endpoint. And the only thing that was different between dominant and non-dominant hand was in the horizontal displacement, accounting for direction. Otherwise, there was no difference in hand dominance in movement. This slide visually shows how the nerve movement was different in directions between dominant and non-dominant side. This figure here shows where the nerve ends, assuming they start at the original point 0, 0. We can see that the dominant side nerves move more towards the radial side, shown in the upper image here, compared to the non-dominant side nerves shown in the lower image. Although we found that the dominant side nerves tend to slide a little bit more towards radial direction, when we look at the movement in all 4 quadrants to look at the combination of the movement directions, there was no difference between sides. Previous studies that only had 15 to 20 participants seem to indicate that there is one quadrant that the nerves move to predominantly. However, in our work, we didn't see any difference between the 2 hands or any preference for any one of the 4 quadrants. The nerves tend to move equally to all 4 quadrants across a sample of 197 people. We've talked about transverse nerve movement. From now on, we will talk about longitudinal nerve sliding. So we categorize the sliding into 3 categories. No sliding is when the nerve and the tendon barely move. Sliding independently from the tendon is defined when the nerve has some sliding but not as fast as the tendon. And sliding with the tendon is defined as the nerve and the tendon is moving at the same speed. We can see that about half the nerves move independently from the tendon, and a quarter of the nerves moves together with the tendon, and a quarter of the nerves didn't move. There's no difference for dominant and non-dominant hands. We also combined the results of transverse and longitudinal nerve movement and explored the associations between them. We found that nerves that slide more with the tendon have more vertical displacement compared to nerves that have less longitudinal sliding. This relationship only exists in the non-dominant hand. In the dominant hand, we found a higher horizontal displacement for nerves sliced together with the tendons compared to nerves slide independently. This result shows that in our healthy sample, nerves that had more longitudinal sliding also had more transverse movement. This association between longitudinal and transverse movement is relevant because it connects the nerve displacement in 3 dimensions. For nerves slide more in the longitudinal direction, they may also get more pulled up or pushed down while gripping. Over time, this movement may cause friction and lead to nerve damage. Also, this study shows that even in a healthy population, median nerve movement is different in dominant and non-dominant size. It shows relevance to clinical practice because nerve displacement can be a potential risk factor for developing carpal tunnel syndrome and may become an early screening or early diagnosed measurement. Future longitudinal study is needed to delve more into the mechanism behind this study. Thank you.